I'm Naren Nadir. I'm the Residency Program Director. I will be in charge of administration for the residency program. So Kaiser Permanente has a long-standing 70-year history of graduate medical education, and we are excited to be able to promote the first ever Emergency Medicine Residency in Northern California. There's only one other Emergency Medicine Residency within the entire Kaiser system, and we are really excited to be a part of this integrated healthcare system with its known focus on patient safety and quality of healthcare delivered, as well as access to an integrated healthcare system. We serve a really large catchment area in the San Joaquin Basin, pretty much ranging from Sacramento to Fresno. We have over 2 million people in that area, and our current membership is at almost 400,000 members in the Kaiser system. And this is going to be what we're going to build our residency program on.
I purposely chose the Central Valley to practice. It's a very diverse area, ethnically, socioeconomically. We are semi-rural, so we'll have some farm accidents, but we also have a lot of commuters from the San Francisco Bay Area who work in the tech industry. So you see a lot of different types of people, which means a lot of different types of pathology, a lot of different diseases that you might not otherwise see in a place that's less diverse.
I'm extremely excited about this. I think it's kind of the best of all worlds that you can possibly have. Being at Kaiser, you get to really be involved in this integrated health system where you're working side by side with all these resources, and you can really help your patients out to the best of your ability and the best of the system's ability. But in addition, you get to experience community hospitals that aren't necessarily integrated. You get to experience county settings. You get to experience pediatric hospitals. And so you get to see every type of patient from every socioeconomic standpoint, and with every type of healthcare and people with no healthcare as well. Part of the curriculum is that residents will be very active participants, which includes actually leading parts of the curriculum. So they'll be doing pediatric case conferences, trauma case conferences, complex case conferences, morbidity and mortality conferences. And this is a great way for residents to kind of hone their lecturing skills as well as teach the rest of us something. Do you also have any kind of... This is going to be a wonderful place to train. You have a great community to work in. You have fantastic teaching attendings to work with. You have unopposed options in terms of being able to do all your own procedures, see all your own patients. The didactics curriculum is very well structured. We have incredibly talented faculty and staff, and you have a plethora of resources as well.
Residency can be challenging no matter where you go. So it's wonderful that here we have places and spaces where residents can get out and experience nature. You can hear all the birds here in our healing garden, and a walking path around the hospital where you can go for some exercise. We have a meditation room where you can go if you just need to decompress. And we have a cafeteria that provides healthy and wonderful food. So Kaiser really motivates us to use these resources that we have for wellness. We like to think of our emergency department residency as a second family. So we love spending time together, whether that's at work or just hanging out. There's always something fun going on.
In modern medical education, it is integral and expected now to have simulation be fully part of the residency curriculum. We're running simulations with simulation mannequins, simulating a real-life patient, a real-life experience, talking to family, getting the kinks out of how to put the monitor on or how to do an IV and resuscitate, in this case, him, through putting in a breathing tube, intubation, putting him on a ventilator, and also performing CPR. So doing that in real time with a simulated patient, but it feels real. So the next time when a real patient comes in with similar symptoms or presentation, we would know what to do. So there's a lot of things that are practical that people don't usually think about when they're studying in a book. We just opened our new simulation center. It's called CEPI or CEPI, and we're really excited about it. It will be fully part of the curriculum. There's sim baby, there's sim children, and we can pretty much simulate anything. They're pretty advanced nowadays. You can see cyanosis, which is the lips turning blue when they can't breathe. You can simulate wheezing. They can cough and talk. Even though it's not real, it does definitely feel real, and you kind of forget that it's a simulation.
From day one, the residents are going to get introduced to ultrasound, and then basically we're just going to keep that going the entire time. What's specific to Kaiser is we already have a really well integrated program where the ultrasounds that we do in the emergency department are integrated into the patient's clinical chart. So we can do a bedside ultrasound and the radiologist can look at our images, the cardiologist can look at our images, the interventional gastroenterologist can look at our images. That allows us basically a quick and efficient way to acquire images that might make a really big difference in the patient care. And it allows the residents to feel empowered to realize how important their bedside ultrasound skills can be in the bigger picture of a patient's care and management. And also it allows the residents basically to feel like they are performing a procedure or a diagnostic test that is essential, essentially, to providing good medical care.
We are very committed to being able to provide some leadership experience to all of our residents. Our hope is so that they will develop an interest and really start going on, after bigger things after life as a resident.
Very good point.
We have a couple of different pods within which we evaluate our patients. So we have the A pod, our critical patients go there. That's where our resus bays are. We have the B and the C pod. The B and the C pod basically are the less acute patients, the ones that are somewhat stable, they go and get evaluated there. We have about 12 beds in each of those pods, and we have the capacity to go up to hallway beds as well for each of those pods. In addition to that, the less acute, more stable, fast-track patients really go to our rapid care area. We do have the capacity for almost 50 patients at any given time for the whole ED. We offer training in a variety of diverse clinical settings. We have an integrated healthcare system. However, the residents from this program are going to be able to practice in any healthcare system. And because of this, we've built in opportunities, specifically county and community opportunities. That way, it's a very comprehensive experience. And that's why we believe it's a really crucial and a beautifully designed program.
One of the things that I think we offer that I find very appealing is that we are an unopposed residency. So what that means is there aren't any other residents here. So you're not going to be giving away all your procedures to residents that need procedures from other residencies. So all of your orthopedic reductions you're going to be doing by yourself or with your attending. All of the OB deliveries, you're going to get every single one of them because there aren't any other residents to compete with. And so I think that's, as an emergency medicine physician, something that's extremely desirable. And us all learning from each other, having journal clubs and pizza together and just discussing things and talking about ideas, I think is really, really exciting.
The Central Valley has a lot to offer. We have Yosemite right at our doorstep. We have Tahoe. You're close enough to go to San Francisco. There's a lot of agricultural around, so it's beautiful to look at. We have wine country out here. The beach boardwalk in Santa Cruz, all of that is all within a car's drive away.
The Central Valley is a fantastic place to be. You have 4 seasons, but they're not brutal winters. It's really kind of the best of all worlds.